I first got interested in ENT really during my surgical training. I did a job at Guildford it was, and it was my first ENT job. And I really enjoyed it. I got on really well with the people that were working there, and I really enjoyed doing the operating and managing the patients, which I hadn't really done on a hands-on basis before really, as a junior doctor. So I really enjoyed that, and that was the beginning really. And since that time I've never really looked back. Because everything's changed so much, so that was the very beginning, and I was doing more basic operations and managing more basic problems like tonsillitis and so forth. Now I'm managing head and neck cancer patients and more complicated conditions, and also technology has advanced. The great thing about robotic surgery and laser surgery is we can do it, it makes the surgery less invasive, and that means less side effects for patients, so less impact on their voice, less impact on their swallowing, but also better survival outcomes. So we're using laser surgery and robotic surgery through the mouth, and we're trying to avoid neck incisions and making the treatments much less invasive. And so the patients have ideally as good as a response in terms of survival, but have much less side effects. And at Cleveland Clinic London, we've got excellent scanners and diagnostic tools to achieve that. And I think the patient focus is really evident, that everything's geared around the patient, from amazing IT systems where patients can look at their results and communications and various documents on their app, to the focus on in the actual clinic, and the nurses and the doctors all working together just to give them a good experience. I think the diagnostics and the capabilities, the technology that's been invested in, the machines that have been bought, the diagnostic equipment that's been bought, and then also working way through to the teams, the medical teams, who are the leading specialists from around the UK who are working here and working together in teams collaboratively, I think is all very different to other hospitals.